Well, hello, my friend Allan.
Hello, Sarah. Great to see you.
It's great to see you. I am here with my friend Allan Calonge. He and I have worked together in the past, have a heart for all things culture, taking good care of people, being very purpose driven and intentional in our leadership styles. And so I'm just so excited that you agreed to come on Healthcare Harmony, where we just kind of talk about all the harmonious things in healthcare and how can we make some of the adversarial places more harmonious, so that people can, really feel good about what they do all day. But I would like, if you wouldn't mind, to first tell anyone that may be listening, who are you, what do you do, and, what are y'all about?
Yeah, thanks, Sarah. Well, as Sarah said, Alan Calonge, I'm a Chief People Officer for core operations for Bon Secours Mercy Health. And Bon Secours Mercy Health is the fifth largest Catholic health system here in the US. It's one of the 20 largest health systems. I have been in this role for just over 4 years, and my role is really focused on all things hospital markets. We have 10 different markets here in the United States. Traditional acute care capabilities, ambulatory, professional. And I think about every day what our operators and our leaders in those markets are worried about. Predominantly staffing, culture, retention, recruitment. And so it's just been an incredible run coming out of COVID when I rejoined Bon Secours Mercy Health back in 2021. Some really tough moments, but thankfully we've done a lot of great work just to stabilize some of the workforce challenges that we've had. And that's my heart. Now we're working into things that are even closer to my heart, which is around culture and aligning the mission and values, which are incredible for Bon Secours Mercy Health, into our front lines as much as we can.
Awesome. Well, I certainly have gotten to know you over the course of our friendship, and I know, you have such a deep heart for people. I know what a spiritual person that you are, and I know like this intersection between all the things that you love is just it's so amazing for you, and I'd love to see all the work that you're doing. Can you talk a
Absolutely.
little bit about, I think some people might say, well, it's easy to be mission focused and it's easy to be, so culture focused when you work in a Catholic organization, because there's a belief that maybe a Catholic organization may be over rotated toward things like that, or it doesn't feel as in conflict with other needs of the business. Can you talk a little bit about whether or not that's true, or how another organization that isn't religiously backed can do some of the great things that you're doing?
Sure, and there's a lot of great nonprofits in the United States that don't have the missional purpose that we do. But honestly, when you're still governed by our the women religious who founded us over 150 years ago, and when your mission statement states very clearly, we are here to, in effect, spread the gospel in many ways. It's hard to ignore, right? That
Hmm.
linkage is there, and we say you don't have to be Catholic, you don't even have to be Christian or a believer to join our ministry, but you do have to believe in the mission, and that is compassionate care in the communities that we serve. And so, when you have in our mission statement the serving the poor, dying, and underserved, as a leadership team, you can't ignore it. That is who we are, and it will be who we are as long as the women religious are sponsoring us, which they do to this day. So that was the reason why I joined the organization originally 13 years ago. Why, after a brief move away, I came back in the midst of COVID because of that personal alignment to my values and the organizational mission and values. It's just it allows me to get up every day and just with a lot of energy and passion serve our patients, serve our caregivers.
Yeah. I remember catching up with you. It's been a while ago, a couple years ago, and you were kind of in the throes of nursing shortages, and there was a lot of energy around pay scales and all those things. And we had a really just very deep philosophical conversation about how throwing money at problems doesn't always solve them, and how, this mission and purpose driven approach to taking care of your people is so near and dear to your heart. Can you talk a little bit about that experience and why you believe so strongly in purpose being core to, engaging with folks?
That's right. Yeah. So Sarah, I mean, it was a dark place, honestly, to be in HR for healthcare because we were experiencing massive outflow of talent. And it was like a bit of a sugar rush application. We needed to shore up some of our pay scales, and a lot of it was just because the market was so on fire at that point. We had agencies, we had other competitors coming in and recruiting nurses because they themselves were experiencing the same effect. And so there was a bit of a that almost cyclone effect that it kept going and going. What we did was we threw over $100 million in market adjustments. We did incredible changes to our benefits programs just to stabilize the workforce as best as we can. We still were seeing huge vacancy. We still were seeing pronounced turnover, and we just needed to shore it up. But it was like a sugar rush for us. We just could not continue to perpetuate that cyclone, if you will. So what we did was, quite frankly, we just paused for a moment and we said, okay, we need to reconstitute our associate value proposition. If we throw dollars at it, we're going to go out of business, and that's not good mission, right? If we are out of business, there's no mission at all. And so pausing for a moment, understanding the heart of our associates, what drives them. Certainly the extrinsic is a critical part of them serving their own families. We need to be market competitive on pay. We need to be competitive on benefits. But where we thought we could distinguish ourselves was in our mission. It was in the ability to grow our associates, to offer flexibility. And so that became the essence of our associate value proposition, trying to reach the intrinsic heart of our caregivers. So that was a lot of the effort over the last couple of years.
Yeah. And did you come up with kind of a tagline or a rallying cry for that work, if I remember correctly?
Yeah, we did. It's our associate value proposition, which is born out of a couple of years of really, really intense work, what really flowed into a new brand. And what that's been over the last year or so, developing with our marketing team, our employer brand or associate brand has been incredible. And so, share your heart, bring your best, be fulfilled. That's in effect the tagline. And that speaks to the notion that if you give, you will receive in many ways. And so we spent a lot of time, a lot of data and analysis, both of our associates and caregivers within our ministry, but also externally as well. Like what draws you to organizations? And so that became our new tagline for the associate value proposition.
Yeah. I love that. And I'm curious about because you said, if you give, you will receive. And my experience is very often people get confused about the order of those two things. That's right. And I'm curious if you have seen through this initiative people embracing the idea of giving first and then receiving when, I think a lot of people are like, well, when I get X, Y, or Z, or this need of mine met, or when I get this other thing, then I'll give more. There's actually a great TED talk about I will be happy, the if then of being happy, which is totally not the case. So I'm just curious about, how has that shaped some of the mindset inside of your associate base?
Yeah, it's fairly early on in us rolling it out. In fact, we saw the initial frames of the data and impact of our new brand just a couple of weeks ago, but it was caveated with, well, we're really only 90 days into the initiative, so we've got a little bit of time for it to settle. But I think what we're seeing is a notion of alignment to mission, which has always been strong, has just been strengthened. Things like intent to stay, we're starting to see initial move towards, the positive impact on that. I think if anything, it's just articulated in a much finer point what folks had already known, which is, working for purpose and working for mission it's a secret sauce in many ways. We are going to bring the goods when it comes to competitive pay, work environment, benefits. But to know that you're doing something even deeper, it's. I think what we're going to see is an uptick on some of those levers that draw people here and keep them with our ministry. So probably something we can cover in a future podcast, Sarah, with really
Awesome.
good data.
Yeah.
Because I got to pause for a moment. Our perception platform, and maybe I shared this with you at an earlier point, but the work that we do around people analytics and perception, it's exceptional. And we've done a lot around building a listening platform that constantly assesses where the heart and mind of our associates is. And they're able to share that perspective, not in a forceful way, but in an open, welcoming, non-pressured environment. We don't mandate the participation in this, so people very willingly, voluntarily bring their perspective to us, and that's a big part of it because we want their true heart. And so it's been something that our ministry values deeply is to hear, to listen, and then to act on it. I think that's a really part of being a credible leadership team, and in and of itself, a big cultural pillar that we focus on, which is an environment that you can share willingly and trust that we're going to do good with that data.
Yeah, that's awesome. I love to hear that. Uh, can you maybe give a couple of tidbits, like if for even for my own organization, if someone's looking to try to get that information? Because I do think sometimes there's a lot of programs that capture the minds. It's really, really hard to capture hearts, right?
Yeah.
So any tips or guidance you would have on somebody going down that journey?
Yeah, I think just very fundamentally, and we took a pretty interesting approach to it. We have here in Cincinnati, where I live, Kroger is headquartered, which is the
Hmm.
largest supermarket chain in the country. And they had a consumer insights division that was effectively doing what we're talking about, but through the lens of a consumer or shopper. We hired a few folks from their data analytics company, and we asked them to build out a perception platform that does exactly what we're talking about. And so we spent a couple of years hardwiring that capability. We built a custom set of questions. It's a dozen different dimensions that range from intent to stay to are we giving you the tools that you need to do your job, and a host of other things that we just need to understand where our associates are. And we built that custom data set with the full understanding that we won't be able to benchmark it against other organizations. And
Hmm.
frankly, we really didn't care. The only organization we wanted to benchmark against was ourselves. And that, over time, that we're making the positive impacts that we need to. In many ways, we're very unique in our geography, in our service lines, in our mission and ministry, in our cultures. And so defining that set of questions was a almost the bedrock of what we're talking about here. So I would say, you know, reaching out and understanding who can support you with that. We use Qualtrics as our platform, our listening platform, not a plug specifically for Qualtrics as much as a really capable data surveying capability. And we even have, data scientists and data engineers that help build the data sets and all the analytics that come from it. So I think investing in that platform is a really critical first step, and trying to understand, can we just take off the shelf a data set? Probably. But
Hmm.
we've got 55,000 associates. We could probably focus on customizing that for our organization. So a lot of nuts and bolts and fundamentals in that, but I would say that that's where you start.
Wow, it's interesting. I didn't really think about the quantification of something that has been traditionally very difficult to quantify, right?
Yeah.
Like as a leader, we get anecdotal information, we get certain KPIs or whatever, and we're trying to figure out, okay, well, what does all this mean? And it sounds like you're really tapping into that connective tissue of here's why people feel the way they feel or why they behave the way they behave so that you can kind of meet people where they are and try to, move them forward.
That's right.
That's awesome.
100%.
That's awesome. And then so I'm going to take that topic and kind of transition it to another topic that I've been talking about a lot lately, which is AI and the impact that AI is going to have in a lot of different businesses, but healthcare specifically. And I was just visiting with my friend Colt not too long ago, and I have a belief that people that are lifelong learners, that are resilient, that can think kind of beyond how does this feel for me, are going to be totally fine in the next version of whatever happens. How are you taking this project, or this, not, it's not a project, but this process that you have implemented at Bon Secours Mercy Health and helped people become more resilient, more change management type, some of that softer skill set that is so important?
Yeah, we're really happy with our change platform, but this is not just a toolkit anymore. I mean, this is hardwiring, understanding of the threats that we face as an organization. So again, using the heart and mind, we've got the mind locked in with our change capability. We just haven't readied the heart for that. Historically within our organization, the HR team has been the change champion. In many ways, we take a lot of pride in supporting our project or business owners with supporting initiatives. But I think in the next generation, it's empowering those owners to be truly the change champions and the change owners. And I think that's a bit of a mindset shift. We've had, I think, an evolution of that over the course of the last few years where we've gotten better with it, but we could take it to the next level. It's almost a begrudging ownership of a project and the change implications of it. But I think they being the operators and our shared service leaders understand that this is an all-in exercise. This is not something HR is going to help us with. A big part of it, honestly, Sarah, and you do a great job of this in my experience with you, is just explaining the why in a really human way, right? In just a fundamental way. And that is really, it's more challenging, honestly, than it sounds. But from our perspective, the reality is that with AI, with a lot of things that are changing, with private equity, with the inefficiency of our healthcare industry, there's a lot of different players entering in the marketplace than there were just 5 years ago, quite frankly. They are virtual, they are digitally enabled, they are AI driven. And so the world that we're looking at as a traditional, acute care hospital-based entity is that we're going to get picked apart on the fringes, if not in our core, if we're not readying ourselves for that reality. And so the change mindset, the resilience of our workforce, we need to absolutely work in that muscle in the next few years. Otherwise, we're going to have just a mountain of resistance across the organization, starting with our frontline leaders in many ways. So yeah, just my perspective in reaction to that question.
Yeah. Yeah, I mean, I think it's funny. I was just giving a talk not too long ago, and it reminded me, I was kind of taking a step back of when did I start in healthcare and what was the healthcare landscape back then. And believe it or not, I've been doing this for a minute or two. And when I started, of course, obviously I'm in the reimbursement space, right? Which is very different, has a little bit of a different take than the clinical space. But in the reimbursement space, I started with, if you got the insurance right at time of registration and you got the charges on the bill, then you would send a bill to the insurance company and you'd get paid a percentage of those charges in fairly short order. Like that was, as long as you got registration right and the charges right, that was kind of where all of our focus was on, obviously in coding and things like that too. But now we have so much overhead and hoops to jump through and policies here and policies there. I know we feel it on the reimbursement side, and it makes it feel like unwinding that is like virtually impossible. But one of the things that we feel so strongly about at Trend is, but there's something in your 20 square feet that you can do to make something better, right?
Yeah.
And I'm just curious, from all of this work that you have been doing, not only are you probably creating change champions about the changes that you want to make for your own organization, but you probably have people that are like, hey, here's a great idea on how to make a process better, how to take care of a patient better, how to get them in faster, whatever those things are. How do you capture all those great ideas from people?
Yeah, honestly, it's very challenging in such a huge bureaucratic organization like ours. But and that's something that we're wanting to hardwire more explicitly in our culture in the coming season. But I think some of our best leaders are those that are resourceful and are able to call those challenges in the moment, doing it in the spirit of love and positivity, and not being hamstrung in their ability to do so. So there is a desire for us to celebrate in many ways those leaders. Even a frontline nurse is a leader in many ways that can call that, and in the moment be able to support if it's a patient that's in distress, or a supply that's just not working, or a process that's broken. Celebrating those individuals that don't just work through it and in a frustrated way quietly, but those that say, listen, I see an opportunity here. An Epic workflow is not working, or this particular bed is got an issue here. How are we pulling in that data to the appropriate folks so that we can make changes? And our new culture that we're looking at, it's really built on this notion of agility and excellence and innovation. And those behaviors will be celebrated. They are celebrated in many ways, but our desire is for a consistent, almost gratitude and embrace of folks who are willing to do just that. So we don't do a great job consistently. We will do a great job of that consistently as we're rolling out some of our new evolving culture.
Yeah. You said a word that I want to maybe double click on. You used the word behaviors. So maybe think about an executive level person, a VP level or above person that may be listening to us today. What are some of those behaviors that they could be embracing in their day-to-day interactions with their team to help get that kind of culture that you just described?
Yeah, I think curiosity is the thing that always, that's something that I always have been impressed with. It's asking the question, and again, in a way that's life-giving, as I tell my kids. Let's, use your words, but be life-giving, right? But just being curious, it's asking those questions. It's not accepting that initial frame as being the answer, even if it's from a position of authority. So, being curious, being courageous, I think those are two things that, from my point of view, I value. It's something that I try and challenge myself with, quite frankly, as a leader. But I love when associates are asking, folks that report to me are asking that next level question, trying to understand it better, or trying to unpack it in a way that can build it up more, in a stronger way. So from my perspective, just really succinctly, Sarah, I think curiosity and courage are two behaviors that I think our culture needs more of.
Yeah, that's so true. And I think sometimes as leaders, we take questions as though it's questioning, which I think
Yeah.
is not the intention. It's very often people are asking questions because they want to understand, they want to connect dots. And the more we can educate people, obviously you can't tell everybody everything. Sometimes it's not appropriate to tell everybody everything, and you can't share all of the context that you have sometimes, or the viewpoint that you have. But helping them understand the why you think the way that you think, or why you see the world the way that you see the world, I think helps them get the context that then encourages them to think about, well, can I change this step? What would the impact be if I change this step, right?
That's right. Yeah,
Yeah.
you nailed it. I think there's some conditioning and context and maybe parameters that you can coach your team into those behaviors. But as long as it's productive, it's aligned to who you are as an organization and the values that you have, like bring it. Like we need more of that, because in the absence of it, you have a pretty stale capability. If you ask me, you're never growing. That's not a growth mindset organization, is the one that's going to suppress those perspectives.
Yeah, that's so true. And I think, in human nature, sometimes we just resist change, right? If we feel like something is happening to us, then we tend to resist it just because it, fosters a sense of a loss of control, or things of that nature. So maybe we talked about kind of like at the executive, if you're a leader of people, how do you behave? What about like at the individual level? How can I as a person become more curious or more excited about change versus resistant to change? Any thoughts on that?
Yeah, again, I think understanding the why is a critical foundation to that. It's understanding some of the challenges that we have, but at the end of the day, I think in our tagline speaks to it: bring your best. We need to bring our best. We are serving a critical mission, but at the end of the day, we're serving a human being, right? And so, what other level of excellence would you want to have? And I got to say something. This is not necessarily, and this might be a little bit controversial or provocative, but it's not necessarily bringing your authentic self to work. Yeah, but it's bringing your best self to work, right?
Mm-hmm.
You are serving a human being who is loved by many, many people. And so my perspective on that is, if you understand your calling in this organization, how are you doing that? You're to bring your best. It could involve understanding the reality of the situation, and how are you going to improve that? And that might be in a very tactical way, like you're walking into a patient room, and you're keeping an eye out on some signs from a family member or the patient that they're not feeling the fullness of the care that you're trying to bring. Why? Why
Mm-hmm.
is that? And it's
Mm-hmm.
making that known to your supervisor, to your leader. That calling is not sleepwalking into work, and it's not sleepwalking through a process when it's broken. It's being intentional about, man, I could improve this person's experience in this moment, not for my own benefit, but for them. And ultimately, it helps us as an organization and patient experience and quality outcomes. And those folks walking home healthier than walking into our hospital. Who doesn't want that? And so, from my perspective, I think that's why we put "Bring Your Best" as very intentionally in our associate value proposition tagline, because this is not a one-way street. This is not us giving to you as an organization. You got to bring something too, right?
Mm-hmm.
And so, yeah, I don't know. That's my soapbox
No, I love it.
for that question.
No, it was so great, and there's a few things that I'd like to unpack there if we can, because you said you kind of said this may be provocative or controversial when you said that may not mean bringing your authentic self. And I want to address that because it's something that I have observed, and that I think that the intention around authenticity can in the wrong hands be taken in a way that is like, now you can behave however you want to behave, and it doesn't matter how
Right.
other people are impacted. And that's not the intention of bringing your authentic self, right?
That's right.
You're bringing your authentic self to work is recognizing that you're human, that you have strengths and weaknesses, that you have a home life, that you have stressors outside of work that the people that work next to you may or may not be aware of. And it's, feeling like you can talk about that you can engage with your leader and your team to see this is me as a whole person.
Yes.
That doesn't necessarily mean that I get to behave in a way like I'm the center of the universe and mine are the only feelings that matter, which is where I
That's
feel
right.
like people take
Have
that.
misconstrued it.
That's
Yeah.
right. That's right.
100%. And that
Yeah.
was more my point. I think you articulated it really nicely, Sarah. I mean, we're, we are built on a very missional foundation that celebrates the dignity of that individual, whether it's a patient or an associate. We celebrate the God-given gifts of that individual. But I think it's been misconstrued, particularly in the culture that we have, where, well, my authentic self is sitting on a couch and eating chips and watching TV, and frankly, I'm just not going to work hard because that's who I am. No, no. We do value who you are and the uniqueness that you bring to the table and the life journey that you've been on. But you still got to walk through the door with that authentic self, bringing the best, right? So I think that's something that is worth expanding on maybe in a future episode. But yeah, I didn't mean to be provocative as much as just call the distinction and
Yeah.
uniqueness of that viewpoint.
Yeah,
Yeah.
no, I think it's so important because it is how we interact with the world around us matters, right?
Yep.
And whether that is happening at work or at the ball field or at your kid's school or whatever, like how you behave and how you interact with the world around you matters. And it's hard to have the culture that you're describing, that I know is your ideal state. You know how I feel about culture and how much I believe so strongly in, we want to create these environments where people love to come to work. When you have people that are those tornadoes, I'm going to call that,
Yeah.
like they're kind of all wrapped up in their own thoughts and feelings, it does impact everybody else's ability to feel joy and to feel inspired and to want to give more. And I think it's an important call out, to be honest. So
right.
I'm glad
That's
that you
right.
did. Yeah.
Yeah, for sure.
Awesome. Well, okay. So there was the second thing that you said that I want to unpack, and that is that the concept of this is a relationship and it's give and take. And I think that it's really hard to find the right balance of that. And some employers, right? Some people in authority I pay you a paycheck and I kind of own you. And it feels very one dimensional. On the other side of the spectrum, there's people that are like, I'm an employee and you need to meet all my demands, right? Like and those are two ends of the spectrum, and that's a very personal viewpoint of the world, right? That's not a stereotypical. So how do you at Bon Secours Mercy Health, in your role, how do you find that right balance of this is a relationship where we are going to do good things together? There's going to be an exchange of a paycheck, right? Funds, but this does need to be a mutually beneficial relationship.
That's right. Honestly, our perception platform is a big part of that. It's an equilibrium. It's a balancing act that we haven't perfected, and frankly, I don't think you ever perfect it because it's always moving. I mean, I would say 2 or 3 years ago, in the midst of COVID, like we were willing to do a lot to attract and retain folks, and so that formula was very much leaning in ways that's different than it is today, where the labor market has stabilized a little bit, and this is not necessarily a give and take in a zero sum game. This is just Okay, we hear you. You need more flexibility in your benefits. Okay, we're gonna build some different options that are cost effective, and you might have to pay a portion of it,
Hmm.
and we'll be able to purchase it at scale on your behalf. So, that's an example, I think, of a tactical equilibrium. I think it's really hard to quantify though in the macro. I think you just gotta feel your way towards it, quite frankly. I mean, I sat with our leadership team this morning, processing our 2026 HR programs, and we were in the midst of that calibration. We know that there are health systems that are struggling to make ends meet right now, that literally are losing cash every single day.
Hmm.
Um, and they won't be able to do some of the things that, with responsible management that Bon Secours Mercy Health has had. So, well, is there an opportunity to leverage it at that moment? So we're constantly just trying to assess where the associates' desires are, where our business realities are, and we say that kind of the cross section of that is where the associate value proposition lies, and that probably shifts and moderates every single day of every single year. So, yeah, I don't know if I answered it, Sarah,
No,
but
that's good.
yeah, it's quite a balancing act for sure.
Yeah, it makes a ton of sense. And, in the context of zero sum games, so we've talked a lot about culture and the people that we work with. As you know, at Trend, we are actively trying to change the way that payers and providers interact. And my observation is that the vast majority of people in U.S. healthcare do believe it's a zero sum game between payers and providers. Do you have any thoughts on how we could, as an industry, move to more of a relationship, give and take kind of approach that you just described inside of Bon Secours Mercy Health?
Yeah, wow. Well, I'm very one-sided in my perspective on this because I'm on the front side of it. From a provider point of view. We're providing care to patients, in a bedroom or in a
Hmm.
hospital room and in a doctor's office, and we're doing a lot of the very heavy work of caring for the mind, body, spirit of these individuals. And um, I think it's challenging to see, quite frankly, and maybe too transparently, where our financials are versus where some of the big payers are. In some ways, it does feel a little bit like we're getting bludgeoned, quite frankly. But when net profits are of some of the big payers are substantially greater than what ours are, when we're literally scratching and clawing for EBITDA that their shareholders would be screaming about. So from my perspective, I think it's challenging, especially in the environment that we're in culturally right now, where
Hmm.
there is so much um, divisiveness. Like it's just another layer of divide in our culture that we're experiencing, quite frankly. And at the end of the day, like it's about money, and it's hard to bridge some of those gaps. But I think there are some areas that you can bridge, and when you can provide care really efficiently, and get someone better, when you can invest in preventive care that even avoids some of the mess that we're in right now. I think those are areas of commonality that we as a provider world and they as a payer world see eye to eye on. So we do take to heart some of those same things. Believe it or not, we do care for the communities and the health of our communities, and we do have capabilities that are there to support that. Those are celebrated and reimbursed by
Hmm.
by the payer industry. But unfortunately, the culture that we're in right now, physically, it's just that's not the way that our country is built right now, and so we are in a very reactive healthcare mode, and the payers are in an unenviable position to resist it as much as possible. But that's just not the reality that we're in. So,
Yeah.
yeah, I'm very one-sided on this, Sarah, because I see. the good that we try to do in our communities and the
Mhm.
challenges that we have in getting there. So yeah, that's my perspective on it.
No, I mean, it's so true. And I've been very public about how I shared that perspective for a very long time because when you work for a provider and you see all the things that you see, like you just described, and it's hard to have a different perspective than what you just described. And I know you well enough to know that you're a very reasonable person. You are open to new ideas, to new information to help shape your opinion. So it's not like you're a right fighter. I know that to be true, but I think it is really hard to see, just like what you said, like you point to these profits in insurance companies as, wow, this doesn't seem like a fair playing field, right?
Yeah,
And
that's
I
right.
think, yeah, I think and I totally understand that point of view. All I will leave you with is this, like, that is going to be the playing field for the foreseeable future. But
Right.
there's a lot of really good people on the field that potentially have the opportunity to make things better in their 20 square feet. That if we focus on the big field, we're probably not going to make much improvement. But if we can focus on like some of the much smaller fields and just try to make something better in that space, I'm just convinced we can do something positive.
I like it. Yeah, that's fantastic.
Yeah. Well, Alan, we are starting to wind down our time together, and I always like to give our guests an opportunity to either talk about something that is important to you that I didn't ask about or ask questions. The next, 5, 7 minutes or so is all yours. Anything you want to chat about?
Wow. Yeah, we've talked a lot about mission. We've talked a lot about culture. I think maybe the thing that we haven't unpacked too much is around two of the other levers in our associate value proposition, which is growth and flexibility. And
Mm.
one of the really fun projects that I've been on since I came back to Bon Secours Mercy Health was trying to build pipelines of talent
Mm.
and doing so with a lot of intentionality that we've never done before. And so I think it's a really resounding win-win for a lot of different factions here. And so that's been super exciting. Sarah is building a tuition program, building a school strategy that is trying to bring more supply of talent into healthcare because we've had such huge gaps that I think were not I think I know were exacerbated with
Hmm.
COVID. And so building out a program that allows an entry level, call it a care companion or a transportation associate to find their calling into, say, a nursing degree and possibly, incredible financial freedom for them and their families. That has been one of the most rewarding things that we've done as an organization. We've increased our what we call internal mobility or growth into registered nursing roles exponentially since I came back just by doing a few things and codifying our career paths, working on the business case to invest in tuition benefits, working with local schools, building clinical rotations and precepting programs where we now have a new cadre of caregivers that just a few years ago wouldn't have been possible, right? So that has been one of the more rewarding elements of my job over the
That's
last few
awesome.
years. And
Yeah.
it's been good for our organization as well because we are closing the demand supply gaps pretty incredibly. We still have a ways to go in a lot of different jobs, not just nursing, but in radiology and respiratory. So that has been a huge win for us and for other health system clients that are listening in on the podcast, that is a critical investment that is very difficult to make right now, especially with EBITDA and operating margins stressed incredibly. But what we've seen is an incredible return on investment. And our agency spend today, compared to what it was just in 2022, is less than a quarter. It's about 20% of what we spent in 2022. And I would say in large degree because of the work we did in listening to our associates. We want opportunity. We want to grow. And we said, okay, let's build it. And if you build it, they will come. And we've seen incredible impact with that.
Oh,
So
that's
that was just one
amazing.
thing that was fun to
I
reflect
love
on.
that. And what an impact you're making on the community, right? When you're
That's right.
investing in people in that way and giving them opportunities that maybe they didn't know that they had, right? Or they didn't even know where to start to, to invest in themselves in that way. I love that.
That's right.
I've got a
Yeah.
heart for Cincinnati. I lived there for almost 10 years in the Cincinnati area. It's such I love it. I go back when I go back home, I always stop in downtown and have dinner at Boca. It's my favorite
Oh
restaurant
yeah.
still to this day, and it's such a wonderful place. It's got a great culture. It's got that Midwestern feel, but it has a lot to offer, and I love just hearing about you pouring back into that community. It's so fantastic.
Amen. Yeah, we love
Awesome.
Cincinnati. So
Yeah, it's
thank you,
awesome.
Sarah, for that.
Well, Alan, any final thoughts before we wrap?
No, it was great to see you. I think this has really got my energy levels way up, and I'm excited for maybe in the next year or two coming back and sharing what else we've done in our journey. So
Yeah.
thank you for the chance to join.
Yeah, I will definitely be reaching back out. I want to hear more of the story in your associate value proposition. I think that sounds amazing. I want to hear more about how you're using all of that, to help drive your culture, and just want to thank you personally for all the amazing work that you do, the way that you show up every day, as I know that you do, the way you love and care for people as much as you do. It makes the world a better place in your 20 square feet, Alan. So thank you for that.
Likewise, Sarah. Yeah, thank
Awesome.
you. I appreciate that.
Well, have a great day. I'll talk to you soon.
You too. Thank you,
Thank you so
Sarah.
much.
Bye bye.